In this presentation, I want to look at this Massachusetts healthcare as it relates to Governor Romney. Because of the amount of uninsured residents in Massachusetts commonly utilizing emergency rooms as a source of primary care, the United States Congress began to pass laws called the Emergency Medical Treatment and Active Labor Act in 1986. The purpose of this was to say that individuals who did not have money to pay for or insurance to pay for had to still be given treatment. The Emergency Medical Treatment and Active Labor Act requires hospitals, emergency rooms, the ambulance services that are necessary to provide care must provide that care to anyone needing emergency treatment, regardless of citizenship, legal status, or their ability to pay. The Emergency Medical Treatment and Active Labor Act applies to virtually all hospitals in the United States. However, it includes no provisions for reimbursement to the hospitals and ambulance services by the federal government. It is a non-funded government mandate from Congress. Therefore, the Emergency Medical Treatment and Active Labor Act is considered as an unfunded safety net program for patients seeking care at all hospital emergency rooms across the United States. This resulting law affected hospitals across the country facing the fact that they were giving treatment without having their bills paid. Thus, they were facing unpaid bills and mounting expenses to care for the uninsured. It's worth noting, by the way, at this point, that this is just another crisis that's been created by the federal government. A law without funding. And the results will be that the states, the individual states, must find a way to resolve the mess that the federal government has created. Well, Massachusetts had a special fund of over $1 billion in 2004 to 2005, known as the Uncompensated Care Pool. Its funding was to partially reimburse hospitals, health centers, and ambulances for these expenses. It was a part of the state healthcare system. The money for this special fund was funded through an annual assessment on, one, insurance providers. Now, who do you think that got passed on to? And two, hospitals. And who do you think they passed on those unpaid bills to? It was to you and I who were paying. And then there were some state and federal contributions that were also brought in and used to put within that fund. Well, it was predicted that the implementation of the Massachusetts health reform law would result in an almost complete elimination of the need for this fund. It was predicted that the amount of money in the uncompensated care pool would be sufficient to pay for reform legislation without requiring additional funding of taxes. However, this was not the case at all, and the state still uses to this day about $453 million of its own money to cover the uncovered cost of legislation, which totaled approximately $1 billion per year. Well, anyway, back to the history of the so-called Romney Care health reform. In November 2004, political leaders in Massachusetts began advocating major reforms of the Massachusetts health care insurance system to expand coverage to resolve the problems that were created by this unfunded mandate by the federal government. It began with the Senate president calling for a plan to reduce the number of uninsured citizens by half. Within a week, Governor Mitt Romney announced that he would propose a plan that would cover virtually all of the uninsured and resolving the growing crisis that the state was facing. It was determined during this time that the Affordable Care Today Coalition would also introduce a bill that would expand Mass Health, that was Medicaid and state children health insurance program. Coverage which would increase health coverage subsidy programs, requiring employers to either provide coverage or pay an assessment to the state. That was not Romney who did that. That was a group that was entitled Affordable Care Today Coalition. The coalition began to gather signatures to place their proposal on the ballot in the November 2006 election if the legislature did not enact a comprehensive care reform for the state of Massachusetts. The coalition collected over 75,000 signatures on the Mass Act ballot proposal. Then the Blue Cross Blue Shield Foundation also sponsored a study entitled Roadmap to Coverage, which proposed that coverage be expanded to everyone within the Commonwealth. Now you have to remember, everybody's being hit up for paying for this unfunded mandate from Congress, and the states are looking at a major crisis on their hands. People have been using hospitals as their primary care physicians. That way they don't have to carry insurance, and it's paid for, and they don't have to pay out of their pocket. And so you have all of these different people, including citizens and non-citizens, who are using this system and using and abusing it, that others are having to pick it up. So now you have people involved, you have health insurance involved, you have hospital systems involved, you have all kinds of people saying this must be brought under control. In October 2005, Massachusetts House Speaker Salvador De Masi, who was speaking at the Blue Cross Blue Shield Foundation, the Roadmap to Coverage Forum, pledged to pass a bill through the House by the end of the session, pushing this comprehensive health care program for the state. The foundation issued a series of reports on reform options at the forum, nevertheless, which they said could include various individual mandates. By the end of the month, the Joint Committee on Health Care Financing approved a reform proposal crafted by House Speaker De Masi, Committee Chair Patricia Walrath, and other House members. In the meantime, Massachusetts was also facing pressure from the federal government to make changes to the federal waiver program that allows the state to operate an expanded Medicaid program. Under the existing waiver, the state was receiving $385 million in federal funds to reimburse hospitals for services provided to the uninsured. The free care pool had to be restructured so that individuals rather than institutions receive the funding. That's where we're at this point in time in the development of what actually leads to the passing of this Massachusetts comprehensive health care that has been labeled Romney Care. In our next presentation, we'll take another look at the continuation of how this bill came into existence and what it means to the state of Massachusetts.